In the first section of the video, what you'll see is an introduction to facial rejuvenation. And in that, it's composed of a number of smaller sections, which one would be facial aging process itself. Linked to that very intimately is the anatomy, and then what we do is a practical portion of trying to do the photography and bring that into the office.
Before we got involved in facial rejuvenation, I would have patients asking me, now that they'd had their teeth done, what could I do for wrinkles elsewhere in their face? And I used to have to say nothing, but now I have something that I can offer them. And so they expect us to be experts of the smile, and the smile goes beyond the teeth.
We're going to have an introduction to facial aesthetics and how it pertains to facial rejuvenation with dentists and incorporating it into the smile design. We will be reviewing the facial rejuvenation in statistics, and then we will go to why we use facial rejuvenation and the facial aging process itself. We will review also the alternative treatments and the specific treatments that will be incorporated to help you in your smile design. The first question comes, of course, is what is facial rejuvenation? And basically it's the use of dental and medical procedures to enhance a patient's satisfaction with their physical appearance. The surgical procedures associated with traditional cosmetic surgery are excluded. Today we have a significant portion of the population that is aging, and like myself as a baby boomer, we're interested in a number of different cosmetic procedures. The cosmetic awareness is heightening in not only the baby boomers, but in all age groups. Today, in the United States, 11.5 million cosmetic procedures have been performed just in 2006 alone, and that has grown. And 83% of these procedures were completely non-surgical, which is a vast change from, say, 10 or 15 years prior. Since 1967, these non-surgical procedures have increased almost like a Boeing 747, 747%. What has happened over the course of the years is the non-surgical cosmetic procedures have increased significantly over these years. The top 5 procedures today are, of course, Botox, they're dermal fillers, and I'm referring to hyaluronic acid dermal fillers, and hair removal, and also microdermabrasion, and different laser skin resurfacing procedures. As you can see, of 2010, there would be significantly more. By age group, if we look, we can see that the most common procedure in under 35 would be hair removal, but over 35, of course, is Botox cosmetic is the most significant. But in all areas, you'll see that the over 35 to 50 age group is significant in almost every procedure. I have this graph to let you see that the number of the procedures over time have been decreasing, and Botox and cosmetic fillers have been increasing together. But as the advertising for Botox and Juvederm have been together, that they work better together. My overall presentation should center on coming from smile design, that the use of Botox, fillers, and other procedures are better together for our overall patients' health and satisfaction. Then we come to the point that why would we be using facial rejuvenation? And the reason is that the aging baby boomers, their desire for a non-invasive cosmetic procedure is increasing year after year. We want to reverse the age-related changes in our appearance. And basically, why do people use it? And of course, studies have found that they feel good about their looks. It makes us look rested and happier. It makes us have an increased self-esteem and more confidence. And of course, there's an income increase. A number of articles, particularly in the Wall Street Journal, have pointed out that all different areas of population, when compared to one another, if a person is more aesthetic pleasing, they have an increase in income. And it could be just because it's perceived knowledge, or it could actually be self-confidence and self-esteem. When we look like a typical patient that is in our office, we have a tendency to basically look at a person and in the past we have just centered on the teeth. And then in the last years of the 1900s, came the advent of the better porcelains and the bonding procedures. So we were able now to really address, in terms of veneers and porcelain, a real smile design or an increased benefit from these two scientific breakthroughs. But now we have patients that will stop and look at themselves with their teeth and want something much more beyond. And in our training, we were taught that all about the head and neck, and we virtually became experts of the head and neck. And now we have to consider how a person feels about the rest of their face and how the teeth blend into the face. So if we were to look at these two photographs and we were to ask ourselves which one would you prove to be your financial advisor, most people would pick the person on the right. And of course, that's just a matter of what we perceive of his knowledge. The same person, he just has an increased cosmetic appeal to us. So why would we use facial rejuvenation? And I think one of the important things is we have to understand what women want, because women are leading this area. That's not to say that men aren't participating. Year after year, the males are increasing in the usage of it. But males need to start understanding the cosmetic and the fashion industries. And of course, as a dentist, we have to read these cosmetic and fashion magazines to really discover what the changes in the population want. Why facial rejuvenation? There's advancements in technology. And basically there's advertising, there's surfing the internet. And now people come into the office and they've already either searched you out on your website or they've already been on the internet and found different statistics. And so when they come in, they're testing you to see if you're up to date on these things. The second area is that people want procedures with minimal downtime, which means that they can return to their normal activities. They could come into your office on a coffee break or at lunch for treatment and return to work without anyone knowing that. If we ask ourselves why do individuals want facial rejuvenation, a number of surveys have been performed, and in the age group of women 45 to maybe 55, you ask that age group if they look in the mirror, what do they see? And if the person looks in the mirror, they feel in their heart they're 10 years younger than the person they see in the mirror. So there's a wish to improve or make yourself more age appropriate or a little tiny bit younger to increase your self-esteem. And we have to ask ourselves this question, are we one of the people that fit in that age group? And as a baby boomer, I am, and so that's where I'm coming from. In the US and Canada, the population over 55 will grow 60% in the next 20 years, which means that this area of facial rejuvenation is just going to increase. A very important statistic here is the baby boomer divorce rate is 50%. And with 50%, we understand that each time a person comes back in for recare into your office, and if they're in my age group over 50, basically what they are remarketing, and means that they've had a chance that they are just divorced and want to look better, want to get a little bit more self-esteem, and they're dating again. If we look at the usage of Botox cosmetic, the US are tied for the per capita use of Botox.